Kuja kofia nani? Penda shika kofia. Hivi iko clear? Iko clear. It's okay. So we can say something? That's good. The members of the fourth estate, today here we are gathered as stakeholders for the Lokichar Sub-County Hospital. Here with us I have the MOH for Turkana South Sub-County. I have the medical superintendent for Lokichar Sub-County Hospital. We have the public health officer. We have the ward administrator for Lokichar. And we have the public health health promotion officer. And we also have that is our health records officer. And we've come here to tell the entire public on the success we've had. It took us a session to have a stakeholders meeting that comprised of the security team led by the OCPD for Turkana South, together with the ACC for Lokichar Division, on the side of the National Administration, together with the Sub-County Administrator for Turkana South and the Ward Administrator for Turkana South, the Board of Management for Lokichar Sub-County Hospital, together with the Sub-County Health Management Team, led by the MOH. We had a discussion to discuss on how we can restore the water reticulation system to Lokichar Sub-County Hospital. This hospital has lacked water for the last 1.5 years. And you could imagine that the entire facility lacking water for 1.5 years, that women could not give birth well in this facility. And even operations could not be done by the medical officer who has been deployed here by the county government. So 1.5 years, the borehole that was handed over by Talo to Lokichar Sub-County Hospital was drilled in Nauyatira in the family of the late Chief Erupe. And sometimes the ball broke down. The entire cost for repairing the ball was met by the family of the late Chief Erupe. And by that time, the Board of Management that was running Lokichar Sub-County Hospital could not manage to do the repairs. And yesterday, we had to discuss on how we can address this prolonged issue that even made the public health officer do notice of closure of this facility. So it is that notice that was made by the public health officer that necessitated all stakeholders coming together. So in the meeting which we discussed, one among the issues which we agreed is that Lokichar Sub-County Hospital Board of Management is going to have further discussions with the family that did the repairs of the ball, and they are going to sit down and see how they can draw the payment plan on how they can settle the amounts that were used by the family to do the repairs of the ball. So we are today reporting to the entire public that we are doing this because this is public good, and we did not wanted to bring any form of politics on this discussion. We decided to bring our synergy, bring all stakeholders together and see how we can address this matter. I understand some people may not be happy on the decision that was reached by the stakeholders, but we want to give our commitment. As a member of the County Assembly who represents the sovereign people of Lokichar, I want to give my commitment as a leader that we will ensure even the remaining process has been adhered to, and the agreement between the family of the late Chief Rupe, together with the Lokichar Sub-County Hospital, has been honored. We are so grateful to the stakeholders who decided to take this initiative. This was not an initiative by the MCA alone. It's an initiative that was taken by the Sub-County Health Management Team, led by the MOH, together with the Medical Superintendent in charge of Lokichar Sub-County Hospital. Number two, I must also thank the county government leadership led by the Sub-County Administrator for Turkana South and the Ward Administrator for Lokichar. And I must also thank the security team led by the SEC, who was representing the OCPD. As we know that water is a right and it's a basic need. Article 43 of the Constitution is very clear on the need for each and every citizen in this republic to have access to clean and safe water. Today we are so happy on behalf of the people of Lokichar. I am so grateful to the efforts which all of us put together to ensure that Lokichar Sub-County Hospital now has access to clean and safe water. And I think going forward, Lokichar Sub-County Hospital now is ready to continue with the surgeries which had stopped as a result of lacking water. And I think even the maternal services will continue as usual, because now I think the water supply in our maternity is now sufficient. And I must also thank Lokichar for supporting this initiative by ensuring that the line connecting to the facility has been repaired. That is our joy, and we are so grateful for water being to the facility. We can confirm, all of us, that water is already here with us, and we had discussions yesterday to see how I can ensure that I get some budget, I think during the supplementary budget, and see how we can support the Baraka village, the village just next to the facility, get again water reticulation, and even have at least a kiosk that is going to support again the vulnerable families living around this area to get access to clean water. That is one of the commitments which I had given as a member of the county assembly, and we are so sure that during the supplementary budget I will get some money amounting to almost 2 million to do again water reticulation around Baraka village, because the KVDA water supply system that was put around this village is not sufficient to cater for the entire village. And again, in the running budget, I have put some 2 million again to ensure that the borehole which was repaired is upgraded, and also the borehole that is at the back of Saimo's residence is also repaired to ensure that water gets into the tank that is at the top of the hill in Lokichar. So those are the commitments that I want to put forth for the public and the residents of Lokichar. And I am committed to serving each and every person who lives in Lokichar. And Lokichar is a cosmopolitan town, which we are hopeful that very soon His Excellency the Governor is going to gazette a committee that is going to check on whether Lokichar has met the threshold of being a municipality. But from where I sit, I'm definitely sure that Lokichar has met all the criteria requirements for it to qualify as a municipality. So what we are only waiting for is the Governor to gazette a committee that is going to now come and ascertain whether Lokichar has met the status of the municipality. And I think in some few months, I'm definitely sure that His Excellency the Governor is going to give us Lokichar municipality. He's going to give us a charter to ensure that Lokichar gets a municipality. Thank you so much.
Members for the state, as the the ministry, as the representative of the ministry in Lokichar, we are happy for a reconnection of the facility with the water, because one of the reasons why we had been facing some challenges within the facility in relation to infection prevention control within the facility was there were no sufficient water to enable us deliver basic health services. One of the subjects that was affected is the delivery mothers around the facility, and the mothers who, and even the children who are in the inpatient, and even the men. So the restoration of this water is a milestone to ensuring that, one, we comply with the Public Health Act that had stated that the facility cannot run without a basic requirement of water, which is actually an IPC issue. This step by itself is a good milestone to ensuring that the mothers who actually been delivering by carrying the water from their homes to support that delivery from now going forward, we get water within the facility. So this is good for us. We want to thank the stakeholders who participated in ensuring that the restoration has been done, starting with the area MCA, the SCA, the sub-county commissioner, the board of management of the hospital, and all the members of the sub-county, and even the security team, because it only takes the commitment of the leadership to ensure that a resource that is important for the public good has been restored. Thank you very much, and God bless you.